United Health Group is simplifying healthcare by investing in tools to help patients know more and pay less. These tools help patients find providers and compare costs and save hundreds of dollars annually. Learn more at unitedhealthgroup.com/commitment.
Bringing your business dreams to life takes heart and about 1,000 decisions a day. That's why Atlantic Union Bank's knowledgeable bankers are here for you with the right guidance and customized solutions to help you reach your business goals. So whether you're planning your next move, upgrading your space, or scaling to meet demand, we make sure your business is ready for what's ahead because we're big enough to support you, yet small enough to know you. Atlantic Union Bank. Any way you bank.
To tip off this NBA season on FanDuel, you can choose your own rewards, which means you can play your game any way you want.
I get to choose my rewards?
Yep.
Great! Now, excuse me while I lock in.
All customers choose your own reward right now in the FanDuel app. 21 plus and present in select states. 18 plus in Kentucky. Opt-in required. Rewards are non-withdrawable. Restrictions apply, including bonus and token expiration, leg requirement, and max wager amount. See full terms at FanDuel.com/sportsbook. Gambling problem? Call 1-800-GAMBLER.
You know what I could really go for right now? Literally anything that comes in a McDonald's carton, wrapper, or bag. Or a McDonald's cup. Yes, any of those items should do it.
We've got your cravings covered. Now stop in for the flaky Filet-O-Fish, the crispy snack wrap, or large fries for just $2.99. Limited time only. Price and participation may vary. Cannot be combined with any other offer.
Ba-da-ba-ba-ba.
Before you begin your road trip, ask yourself, do you really need 5 full suitcases? With the 2026 Kia Sportage X-Pro's class-leading cargo space, you'll have room for what you need. Find out more at your local Kia dealer today. Keep the adventure going. Kia, movement that inspires.
Call 800-3334-KIA for details. Always drive safely and obey all traffic laws. Comparisons based on second row legroom and cargo space behind second row seats in the subcompact SUV class according to Kia segmentation as of October 2025.
There are so many unspoken rules of healthcare that not being in the know can seriously affect how you access care, when it's available, and how much it costs. The Patient Advocacy Foundation is one nonprofit working to spread this knowledge, often helping people with problems they weren't even aware of.
We actually say the reason people call us is never the reason people call us. So someone may say, I'm calling because I have a big bill and I just need to find money to pay for it. But then once we start working with them, we figure out they're not on the right insurance plan and they would qualify for all these different benefits, and we can find them transportation to their doctor's appointments. And so we're with them through that whole journey and teaching them how to advocate for themselves and how to apply for the right things.
That's Caitlin Donovan, Senior Director at the Patient Advocate Foundation. Millions of Americans have medical debt and don't realize that there are options that can reduce their expenses and help them strategize payment plans. Donovan says the first mistake many of us make is paying our medical bills right away without checking for mistakes.
So many medical bills have mistakes in them. Oftentimes, even insurance will get something wrong about how much you owe. So the last thing you ever want to do is get a medical bill and pay it right away. Make sure you're checking for mistakes, like against your explanation of benefits. Make sure that they have your basic information correct. Even that generally you should know what your deductible is for your health insurance plan and how close you are to meeting it. Myself, I have 3 kids, so we're a family of 5, and I've more than once had the insurance company come in and with our deductible incorrect and think that we owe more money towards a bill than we actually did. So it's really important to check and know your own plan and make sure you're getting your full coverage benefits.
While checking for mistakes takes time, it can save you a lot of money in the long run. However, there is a limit to how helpful a watchful eye can be. Donovan says she used to be a big proponent of asking for an itemized bill, but that with today's systems, the potential benefits don't often outweigh the time and effort.
I have been with Patient Advocate Foundation for about 13 years. 13 years ago, I used to say, ask for the itemized bill, check to see that everything is correct on it, that you weren't overcharged for X when you should have been charged for Y. However, in the time from then until now, the number of billing codes has doubled. And not only that, you can also amend a billing code. something may look wrong that isn't. And at this point, there are billing coding professionals, and the likelihood that you'll be able to really drill down and catch something that's wrong may not be worth your time.
But like she mentioned before, Donovan still encourages everyone to check for simple, straightforward mistakes because the chances of finding at least one are high.
About half of all medical bills have mistakes in them, so checking for the obvious is a good place to start. Make sure it's actually your bill. Make sure it's been billed to the right insurance company. Check and see when your explanation of benefits comes in the mail that what the insurance company is saying you owe aligns with what the hospital is actually billing you or the doctor's office.
Basically, take the time to check all of your bills instead of blindly paying because there's a good chance it'll save you money. Not only has research proven this, but it held true when Donovan conducted her own personal experiment.
When I was pregnant with my youngest, I kept a spreadsheet of all the costs associated with that pregnancy, just for fun, to see if what we've been saying all along about the number of mistakes and bills would apply to me. And not only did exactly half of my bills have mistakes in them, but if I hadn't caught them, it would have cost me about an extra $2,000.
Donovan says when you catch a mistake, it's often an easy fix by calling the billing office, and the most annoying part is simply being on hold for a bit. However, there are cases that are much more difficult and require unyielding persistence and patience. Donovan had this experience after her 20-week ultrasound appointment. She received a bill for $500 even though she'd already met her deductible. However, when she called her insurance, they informed her that she was mistaken and the bill was correct.
So I did something I almost never do, and this comes full circle to why we always delay before we pay, and that is that I sent a check for about $500 right away. And then the next day I got another bill for about $500 in the mail. And I call my insurance company again, and they say, oops, we thought that was the one you meant yesterday. So you do owe that one, but the one yesterday you don't have to pay. And I had already paid it. And then that was for a 20-week ultrasound. My son was walking before I got that money back.
It took her more than 25 phone calls and multiple conversations with the billing office and insurance company, both on the line, which weren't always productive.
The billing office would lie to me and say that they had taken care of it, only for a week later for them to say that they hadn't, or that they had talked to someone when they hadn't talked to someone. And when finally it all worked, the conclusion was that my insurance company called me and to say, we want you to know after all this that we finally received the correct bill from them and we sent them the refund check. So you should be getting a refund from them.
Donovan still had to call the billing office and demand her money back before they finally sent a check.
I like to share that story for a couple of reasons, but the big one is that I do this professionally. I have been with the organization for 13 years. I know the tricks of the trade and the ins and outs and the pitfalls, and yet it still took me that much time and that much maneuvering to get what was actually already mine to begin with. So I am so intent on making sure people know that the help is available for them because most people don't have any of that context or knowledge.
Another major piece of information that many people don't know about is that the price you owe isn't always the price you have to pay. Donovan says many people unknowingly qualify for financial assistance through their hospital.
A lot of hospitals won't tell you up front that you qualify, so you have to seek out that information yourself. And you should never assume that you won't. A lot of hospitals, I know New York hospitals, that will provide assistance up to incomes in the six figures. So that's out there and it's available. But different hospital systems will qualify you in different ways. For some, you have to live within a certain geographic range even of the hospital. It all depends on what they've set up and what they provide. So, and sometimes how much you make may qualify you for getting a complete 100% wipeout of your entire medical bill, or sometimes it may provide a discount, but that is the absolute best place to start.
After checking if you qualify for financial assistance, you can also look into negotiating your bill. But before calling the billing office, find out how much your care usually costs, what your insurance covers, and how much you're able to afford.
What your goal is to see what a reasonable price would be, including what your insurance has already paid. and then look at what you can afford. Most hospitals will set up some type of payment plan. It is better financially to set that up with them rather than, say, putting $20,000 on a credit card and dealing with those high interest rates. The key is to offer them something and see if you can lower your overall commitment, because ultimately so many times hospitals are going to be worried that they won't get anything out of you. So if you are responsible, if you're responsive, if you're offering something and you're working with them, you have a pretty decent chance of being able to get yourself into a good position for success.
If you find yourself still unable to afford the final amount, there are other out-of-the-box options available. Donovan encourages people to look for other organizations that may be able to ease financial burdens in different aspects of their lives, not just in the medical world.
Say you have a bill because you have a cancer diagnosis and you had surgery in the hospital. Don't just look for cancer funds, although that is a great place to start. There are a lot of cancer funds. Go further than that. Look for financial assistance for cancer patients, for housing, for transportation. I don't know about you, but I don't have a separate bank account for my mortgage and a separate one for my groceries. They're all in the same account. And think about that when you think about what you're pulling in to assist you. If you can free up money that would have gone towards your rent or mortgage and put that towards that medical bill, you're still coming out ahead.
The Patient Advocate Foundation has a national financial resource directory that makes it easy for anyone to find organizations that fit their unique needs.
There are so many ways to lower your costs and so many great organizations out there to help you once that you've negotiated or even once you've landed on a final number, that doing it completely by yourself and paying full price is really shortchanging yourself.
The full list is available at patientadvocate.org/financial. You can also find it and more information about Caitlin Donovan on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farrah. Our production manager is Jason Dickey. I'm Greg Johnson.
Healthcare can feel complicated. That's why Optum uses technology to connect the people and processes that make healthcare easier, more affordable, and more effective. We're making it clearer for you to know exactly what your benefits cover. And to help you better manage your health, we're coordinating care between your doctors and your technology. We believe better, simpler healthcare is always possible. That's healthy optimism. That's Optum. Visit Optum.com to learn more.
Few things are as uplifting as the greatest moments in sports. And nothing brings us together quite like Team USA at the Olympic Winter Games. From NBC Universal's iconic storytelling to the innovative technology across Xfinity and Peacock, Comcast brings the Olympic Games home to America, sharing every moment with millions. When Team USA steps onto the world stage, we're not just watching, we're cheering together. This winter, we're all on the same team. Comcast, proud partner of Team USA.
Hi, I'm Michael from the War and Treaty. You know the jingle. Now discover the facts about Ozempic, a GLP-1. Only Novo Nordisk makes FDA-approved Ozempic. Learn about the real thing.
Talk to your healthcare professional today. Call 1-833-OZEMPIC or visit Ozempic.com to view the medication guide and to learn more about Ozempic. Semaglutide injection 0.5 milligram, 1 milligram, and 2 milligrams.
To tip off this NBA season on FanDuel, you can choose your own rewards, which means you can play your game any way you want.
I get to choose my rewards?
Yep.
Great! Now, excuse me while I lock in.
All customers choose your own reward right now in the FanDuel app. 21 plus and present in select states. 18 plus in Kentucky. Opt-in required. Rewards are non-withdrawable. Restrictions apply, including bonus and token expiration, leg requirement, and max wager amount. See full terms at FanDuel.com/sportsbook. Gambling problem? Call 1-800-GAMBLER.
You know what I could really go for right now? Literally anything that comes in a McDonald's carton, wrapper, or bag. Or a McDonald's cup. Yes, any of those items should do it.
We've got your cravings covered. Now stop in for the flaky Filet-O-Fish, the crispy snack wrap, or large fries for just $2.99. Limited time only. Price and participation may vary. Cannot be combined with any other offer.
Ba-da-ba-ba-ba.